The title of today's program is Can Supplements Be Used to Manage Attention Deficit Hyperactivity Disorder? In looking for non-prescription ways to manage behavior in ADHD, many parents turn to various supplements. Over 25 different ones have been touted for managing this disorder. This program really is limited to a discussion of the supplements and does not delve very deeply into specific diets, prescription medications, or other non-drug interventions. To answer the question of whether supplements are effective, we have to start with a brief overview of ADHD, including the subtypes, so we're all on the same page. Next, we'll talk about the various supplements which are touted for management. We'll, of course, focus our time on those supplements which, based on scientific evidence, would likely improve relevant issues in ADHD. Wrapping up the program will be a case to apply the knowledge we've acquired. What do you think when you hear ADHD? Well, the stereotypical patient is a young boy with inattention, hyperactivity, impulsivity, academic underachievement, and behavior problems. But this is just a generality. It's true that ADHD is more common in males than females, but girls have it too. Also, adults have it. And it very commonly runs in families. Because our level of consciousness about ADHD is pretty high, you might think it's a relatively new disorder. But guess what? It isn't. Was first documented in 1775. Of course, it wasn't called ADHD then. The diagnosis was first codified in the Diagnostic and Statistical Manual of Mental Disorders, second edition, in 1968. And it was called hyperkinetic reaction of childhood. Later, it was called attention deficit disorder, or ADD, with or without hyperactivity, and in more recent years, the name has changed to ADHD. There are 3 subtypes based on symptoms. The inattentive type, this is where kids and adults have behaviors like failure to pay attention to details and difficulty organizing tasks and activities, difficulty staying on task. There's also the hyperactive impulsive type, where this is sort of your typical person with ADHD you think of. They have excess talking, fidgeting, and inability to remain seated in appropriate situations. The third type is combined, where a person has symptoms of both inattention and hyperactivity impulsivity. The combined type is actually the most common. Hyperactive behavior does tend to decline more quickly than impulsivity or inattentiveness as a child ages. What about etiology? Well, we really don't know why people have ADHD. It appears to be some combination of a genetic predisposition and some environmental insult, such as a mother smoking while pregnant. But there's been many things that have been related to the development of ADHD, so we don't really know exactly what the environmental influences are. There are many theories about what actually underlies this process in the brain, and there really isn't a single theory that explains all the different symptoms and characteristics of ADHD. There is most likely a dysfunction or dysregulation of dopamine and norepinephrine in the brain, especially given that medications that affect those systems, like stimulants, work to manage symptoms. ADHD is the most common psychiatric diagnosis of childhood. It's hard to get exact numbers, but it's thought to occur in about 9% of males and almost 3% of females. Girls are less likely to be diagnosed, though, because their behavior often is not as overactive or disruptive. Girls are more likely to have the inattentive subtype. ADHD, of course, also occurs in adults. About 50 to 60% of children diagnosed with ADHD continue to have symptoms as adults. You also find if you actually ask the right questions, many parents of children with ADHD had some of the same symptoms as children. They may never have been diagnosed, and they may still have those symptoms as adults. Between 4 and 5% of the adult population is believed to have adult ADHD. There are many common coexisting disorders, and sometimes it's difficult to determine which is actually causing behavior issues that children are having. Oppositional defiant disorder, conduct disorder, anxiety, depression, Tourette's, OCD, autism, various learning disabilities all commonly occur coexisting with ADHD. Treatment of ADHD usually requires a combination approach that combines both behavioral therapies with medications. Behavioral interventions might range from specific school behavior plans to family counseling. Complementary to behavioral therapies and medications are treatments listed on the right side of the page. We'll talk a little bit about dietary modifications near the end of the program. Many things are coming out now that exercise is beneficial in these patients because it alters neurotransmitter levels in the brain in a positive way. Some people have even called exercise an ADHD med without side effects. And there are lots of other things that families will many times try: cognitive training, sensory integration, various relaxation techniques, and of course, non-prescription supplements, which is what we're going to focus the majority of our remaining time on. Here I use the phrase non-prescription supplements to refer to vitamins, minerals, herbals, and other supplements. So anything that's not a prescription treatment for ADHD. From one community survey, 64% of families use some type of complementary and alternative interventions. This could be any of those things mentioned on the previous slide and many others I didn't even list. As you can see, a significant number of families use vitamins and other supplements. Much of this use in these surveys was truly as complementary to prescribed interventions, but there are families who seek totally non-traditional methods to manage ADHD. Importantly, in community surveys, only 11% of families discuss these interventions with their healthcare providers. Before we begin talking about the individual supplements, I wanted to review the efficacy rating systems that I will report for each agent discussed if one's available. Based on scientific evidence, Natural Medicine's database rates various supplements. For efficacy, they use ratings, as you can see here, from effective to possibly ineffective. Very rarely does Natural Database rate something actually effective because it requires multiple randomized, double-blind, placebo-controlled trials to get that effectiveness rating. And you really don't see that with a lot of natural supplements. They also rate safety of products, and really I only point those out where there might be a safety issue with a particular product. The next slide shows a recommendation chart for natural medicines used for ADHD in children, and this is from Natural Database. And you can see that across the top is safety and down the side is effectiveness. There are a large number of supplements touted for ADHD. We obviously cannot cover all of these in 1 hour, but I'll spotlight a few of them, including the 2 that are considered possibly effective and a few of the ones with insufficient evidence, mostly focusing on those I see mentioned most frequently on the internet or that questions get asked about. I also put this chart here so you at least have a reference point when patients might ask you or families might ask you a question about a particular product. At least you can see that it's rated, for example, insufficient evidence. The chart on the next slide also comes from Natural Database, and this is recommendations for use of products in adults. And you'll notice here there are no effective, likely effective, or possibly effective products in adults. And that's primarily because these products really have not been studied significantly in adults. The only ones with studies actually in adults that I can find are phenylalanine, pycnogenol, tyrosine, and SAMe. Of those, only SAMe has one small open label trial we'll talk about that showed some efficacy. As we go through the various supplements that I've chosen to spotlight, I've tried to pair them with their prescription counterparts if relevant. Prescription stimulants have been used for ADHD since the early 1960s. Depending on how you define efficacy, prescription stimulants work for 80 to 90% of patients. In children, stimulants enhance attention and focus. They also do that in adults. In children, though, stimulants actually tend to reduce physical activity and energy and appetite. Hyperactivity is not as much of an issue in adults with ADHD, so that's not really a concern in treating adults with stimulants. There are, of course, some non-prescription stimulants, and people have looked to those as alternatives. Caffeine is the best known. Some research actually suggests that high-dose caffeine alone might modestly improve ADHD symptoms, but when studied, it was less effective than methylphenidate or dextroamphetamine. Of course, the effectiveness of high-dose caffeine, or I really should say, the use of high-dose caffeine up to 600 milligrams a day in children is considered controversial. At doses of 300 milligrams per day, caffeine is no better than placebo for ADHD in children. It's also been studied in combination with methylphenidate and dextroamphetamine. It doesn't seem to improve their individual effectiveness. So really giving two stimulants together, and you see that used done sometimes, giving two stimulants together really doesn't seem to improve individual effectiveness. Natural database rates caffeine for ADHD as possibly ineffective. I don't honestly think it's something we can recommend to families. The other thing listed here is dimethylamine. It's also known as DMAA. It's another stimulant that's occasionally used. It's most commonly found in products used as a pre-workout supplement for athletes and bodybuilders. But due to its stimulant effect, it's also showing up in products promoted as an alternative to prescription stimulants. There are no trials of DMAA in ADHD, and it's also been linked to reports of cardiovascular toxicity, and it's been banned in several countries, including Canada and New Zealand. Centrally acting non-stimulants are also used in treating ADHD. The norepinephrine reuptake inhibitor atomoxetine increases brain norepinephrine activity. At this time, I can't find any supplements that act similarly to it. It appears to be less effective than stimulants. Antidepressants can also have a role in ADHD treatment, but these agents are less effective compared to stimulants. They can be used as adjunctive therapy to stimulants. They can also be used alone after treatment with several stimulant products have failed. Sometimes an antidepressant is added to therapy to counteract the stimulant side effects, such as sleep disturbances or decreased appetite. Of course, antidepressants can also be added to treat comorbid depression. The two most popular natural antidepressants are St. John's wort and SAMI, S-adenosyl L-methionine. St. John's wort appears to work similar to conventional antidepressants, but the only published trial of it in ADHD found it to be ineffective. SAMI increases serotonin turnover and increases dopamine and norepinephrine levels in the brain. Preliminary research suggests it might improve attention, restlessness, etc. in adults with ADHD, but unfortunately that was only a very small open label trial of 8 adults. Now 6 responded, but it was open label, wasn't placebo controlled. So at this point we really have no major evidence to say that it's effective in adults, and there are no studies in kids. Some other centrally acting agents are occasionally used in ADHD treatment. Alpha-2 blockers are effective in managing many behaviors, clonidine and guanfacine. Occasionally, antiepileptics like carbamazepine and valproic acid are used, but not terribly often, and there really are no supplement complements to those agents. Several nutritional deficiencies have been reported in kids with ADHD. Now, whether these deficiencies are contributors to the condition or a result of poor diets or the result of medications is unknown. Improvements in behavior symptoms have been seen when at least zinc, iron, and magnesium have been supplemented, but that is in kids that had started out with low levels. The best response for various mineral supplements is seen in those who are tested and found to truly be deficient. Zinc is an important cofactor for metabolism relevant to neurotransmitters, and it indirectly affects dopamine metabolism. Specific to ADHD, the dopamine transporter has a zinc binding site that blocks transport. Several studies have been published looking at zinc supplementation and its effect on ADHD-related behaviors. The majority of them have come out of Middle Eastern countries where zinc deficiency is actually endemic because of the soil composition. The value of zinc supplements in U.S. populations is not well defined, and there's only been one U.S. trial published. In that U.S. trial, 15 milligrams of elemental zinc twice a day was added to stimulant therapy. They actually saw a modest symptom improvement and a reduced amphetamine dose. Zinc might be an option in people, one, who have a documented zinc deficiency, which is rare in the U.S., but also in people who have poor response to stimulant therapy or in an attempt to reduce stimulant dose. Zinc supplementation is rated possibly effective by Natural Database. If families are interested in trying zinc supplements, there are a few things that are important to know. One is zinc sulfate is the particular compound that has shown efficacy. Studies with others have not necessarily shown efficacy, and it's a question whether the others were absorbed adequately. Problem is, zinc sulfate has more GI effects. You see fewer with other forms. Zinc does appear to interfere with iron absorption, primarily within 30 minutes of ingestion and only when the two are given concomitantly. What I can find is if someone is taking both zinc and iron supplements, if they're taking them together, they can take them with food, or they can separate them by 30 minutes to avoid this interference with absorption. Another issue with long-term use of zinc supplements is when used alone, you can end up with an iron deficiency because of interfering with iron absorption, and doses greater than 40 milligrams a day can cause a copper deficiency. All the products tested by consumerlab.com contain the amounts labeled and were free of contaminants, so that does not appear to be an issue with most zinc supplements. Here I've listed the max daily recommended dose. ADHD, if someone wants to try this for symptoms, I suggest 15 milligrams twice a day. It does appear that once a day dosing is not as effective. There's a little bit of information out there that kids with ADHD may have a zinc wasting syndrome, in that they excrete too much zinc. At least one study found that once a day zinc was not as effective as twice a day. It appears that they eliminate it too fast, so that you may require twice a day dosing to be effective. Aim for 15 milligrams of elemental zinc twice a day. Now, it's hard to find a 15 milligram product. Whole Foods makes one. Parents may have to buy 30 milligram tablets and split them to get the 15 milligram dose. Iron deficiency is another important thing to consider in ADHD treatment. Iron's needed for the synthesis of dopamine, norepinephrine, and serotonin. Some studies have found correlation between serum ferritin levels and behavior scores and stimulant dose. Some very preliminary clinical research suggests that iron supplementation might improve symptoms in kids with low ferritin levels. This next slide shows you the relationship between ferritin levels, which are a marker of body iron stores, and stimulant dose. So as one's ferritin concentration increases, lower stimulant doses are required to manage behavior. 2 small studies have investigated supplementing kids with ADHD with iron. The first was only in 14 non-anemic boys. They gave them ferrous citrate for 30 days. It increased their ferritin level and improved behavior. Now, they were not necessarily iron deficient. The other study looked at 23 non-anemic kids, but they had low ferritin levels. Gave them ferrous sulfate, 80 milligrams a day for 12 weeks, compared it to placebo. They saw improved behavior scores, but it was not statistically significant. What I take away from these small studies is that kids with ADHD probably need to have their ferritin levels checked before they start on any therapy and occasionally thereafter. It's been shown from US-based surveillance studies that 20 to 30% of kids with ADHD have low ferritin levels. So I think that's an important thing that needs to be checked for and needs to be fixed if they have low levels, even if they're not anemic. Natural Database does rate iron as insufficient evidence, primarily because these are very small studies. If a patient's going to be on iron supplements, the recommended daily intake of iron varies based on one's age and gender. For boys and girls between the age of 9 to 13, the RDI is 8 milligrams a day. I think it's important that we make sure kids with ADHD, if they're not already iron deficient, I think we need to check to make sure they're getting sufficient iron every day. If someone's iron deficient, you can use higher doses, up to 300 milligrams a day max. What's recommended in kids is 2 to 6 milligrams per kilogram per day divided in 3 doses. There are definitely issues with absorbing iron supplements. Maximum absorption is best if taken on an empty stomach, but that gives most people GI upset. Usually I recommend people try it on an empty stomach. If it doesn't work on an empty stomach, to take it with a small snack, but avoid dairy, coffee, tea, or cereals at the same time. If somebody has iron deficiency, it can take 2 to 3 months of treatment to reverse iron deficiency anemia, but that doesn't completely replenish their iron stores. Treatment usually needs to be continued for 6 months to completely replenish iron stores in someone who started out truly deficient. Blue-green algae is a product that's widely touted for ADHD, primarily because it contains iron, B vitamins, gamma-linoleic acid, an omega-6 fatty acid, and various amino acids. Although often called blue-green algae, that name really is a misnomer. It's actually a bacteria, cyanobacteria. Most commercial products contain the 3 species listed here. Natural Database rates blue-green algae as insufficient evidence because there are no studies of efficacy in either adults or kids. I bring up blue-green algae, 1, because it's widely touted, but 2, because Natural Database rates it likely unsafe for kids. It's rated unsafe because blue-green algae products vary widely in purity. Unfortunately, they have not been tested by consumerlab.com, so I can't tell you any good products that are out there. Other testing that has been done on these products has found blue-green algae products to be contaminated with microbes, heavy metals, including mercury, cadmium, lead, or arsenic, radioactive divalent and trivalent metal ions, and a toxic species of blue-green algae, Microcystis. This species produces potent toxins that can cause hepatotoxicity, abdominal pain, and even shock and death. Apparently, children are more sensitive to the toxins than adults. You can also find anatoxin in some products. The contaminants found in blue-green algae depend on where it is grown. Some are grown under controlled conditions and others are naturally harvested. Many products are labeled as coming from Upper Calumet Lake in southern Oregon. Unfortunately, periodically, depending on the weather conditions, products harvested from there can have a significant amount of this particular toxic species, Microcystis. Some states, such as Oregon, actually require producers to strictly limit the concentration of microcystins in their blue-green algae products, but those same protections cannot be assumed to be applied to all products on the market. The maximum safe intake of microcystins is not clear, and it's possible that when blue-green algae is used for a long time, the toxic effects may build up. And, long-term use by children raises particular concerns, especially in light of the widely popularized but unsubstantiated belief that blue-green algae is useful for attention deficit disorder. I suggest that parents avoid blue-green algae. Doesn't seem to be as much of an issue with the toxicity in adults because they can withstand higher levels of the toxins. Shouldn't be used in kids because there is no evidence that it works, there are no studies, and there are potential risks. And we don't have a way to identify good quality products with it. Omega-3 fatty acid supplementation is one of the most studied alternative treatments for ADHD. Lower levels of polyunsaturated fatty acids, particularly omega-3s, have been found in kids with ADHD. Some have speculated that these lower levels contribute to the symptoms, but cause and effect have not been proven. Remember that omega-3 fatty acids cannot be synthesized de novo by humans and instead are required in our diet, so they're considered essential fatty acids. In the Western diet, omega-6 fatty acids or their precursors are much more abundant than omega-3s. Many people think that part of the rise in ADHD might be related to our imbalance between omega-3 and omega-6 fatty acid intake. Of course, that hasn't been proven, but we do know that many kids with ADHD have low levels of omega-3s. At least 13 trials have studied omega-3, omega-6, or combined omega-3/6 supplements. Unfortunately, overall, when you combine all those trials together, there's no effect because they included omega-6s. It appears that it's really omega-3s that are important. Those are what have the anti-inflammatory effect, would seem to have the cell membrane stabilizing properties. If you look just at omega-3 fatty acid supplements, particularly fish oils, there does seem to be a benefit. Fish oils are rated as possibly effective for kids by Natural Database. They're rated as insufficient evidence for adult ADHD because there are no trials in adults, at least that I can find. This next slide shows you the overall effect of omega-3s from the omega-3 only studies compared to prescription stimulants. And this plot plots out the difference of omega-3s versus placebo in those trials, and that's the dots you see in the center of each little line. The overall effect of omega-3 fatty acids is shown by the black diamond, and the overall effect is 0.31. Well, what does that mean? Further away from zero, the more effective on the positive side. It's sort of a way to think of it. Compare that to prescription medication. So methylphenidate from studies, its effect size is 0.78. Atomoxetine is 0.64 and clonidine 0.58. So that's kind of the way you can rank these things in efficacy. Stimulants are most effective. The non-stimulant things like atomoxetine and clonidine are less effective, and omega-3 fatty acids are further down the chain in efficacy. Bottom line with omega-3s, supplementation, particularly with higher doses of EPA, that is greater than 450 milligrams a day, is modestly effective. They're not as effective as prescription medications, but they may be a reasonable choice to add to prescription stimulants or families who decline the use of prescription medications. And you really do see minimal adverse effects with omega-3 supplementation. And again, this could be done through increasing dietary intake, but because it's hard to get 450 milligrams of EPA a day, it's probably easier to do it with supplements. There are no good guidelines out there on dosing of omega-3s in ADHD. Now, my suggestion is if someone wants to try this, to get as close to 450 of EPA per day as they can reasonably get with a product. Why 450? That comes from a graph looking at efficacy of omega-3 daily intake versus behavior scores. 450 milligrams a day is where you see the best change in behavior scores. For this table on this slide, I picked some widely available products that passed consumerlab.com testing to show you how much someone would have to take of various products to get 450 milligrams a day. So it varies from 3 capsules a day to 1/4 of a teaspoon. Teach parents how to read the supplement's facts label, and you really only want to recommend a product that has been tested. It should have either a USP or a consumerlab.com label on it, and you want to recommend a product that lists the actual amount of DHA and EPA on the label. Remember, you can't just look at a fish oil supplement that says it's got 1,000 milligrams of fish oil and assume you're going to get enough EPA. You got to look and see what the content of EPA actually is. And you really don't want any omega-6 added, or as little as possible in a product. The website listed here on the bottom of this slide, that is an international omega-3 supplement group that tests products also. It may be harder to find a US-based product in that listing, but it is one way to access some testing results. Another thing I think important in trying to prevent, maybe, there's no scientific evidence for this, but in trying to prevent ADHD, pregnant women should get adequate EPA and DHA. DHA, important for brain development. EPA appears to be important also, not just for brain development, but also for stabilizing neurons and maybe preventing the development of ADHD. I've seen a few studies that correlated intake during pregnancy with development of ADHD. It's not proof yet, but it's interesting data. One interesting product that's out there that I only recently discovered in reading some natural mommy blogs is a linked combo of phosphatidylserine and an omega-3. This product is marketed as a prescription medical food. Now, the big thing to know about medical foods is they're supposed to be used under medical supervision, thus that's why they require a prescription, but they are not FDA approved as a drug. They are FDA reviewed sort of as a food. So they have to be generally recognized as safe food products. This product gets a lot of chatter on the internet. You can see what each capsule contains. It's not a whole lot of EPA. From the studies of EPA alone, the studies of fish oil alone, we talk 450 milligrams a day. That's a whole lot here. Supposedly, what the company markets here is because it is bound to the phosphatidylserine, it's able to cross the blood-brain barrier, and you can get more EPA into the brain where you want it than if you give EPA alone, or if you give EPA and phosphatidylserine as 2 separate products. Now, that's their marketing pitch. Not been compared to giving those 2 products alone. There is one published double-blind placebo-controlled trial with this particular product. 147 kids finished the study and were included in the data analysis. They took 4 capsules a day for 15 weeks in a blind trial. Saw a significant reduction in parent behavior rating scale, but not in teacher scales. It's an option for people to try. Requires a prescription. A lot of places don't stock it, but if you encounter it, people asking you questions about it, I wanted to let you know about it. It would be interesting to see a study that compared this versus a stimulant versus the 2 separate products. Because studies that have looked at just phosphatidylserine by itself have not found it to be effective. Ginkgo is a supplement you might not think of first when you think about things for ADHD. It's, of course, most commonly used for various kinds of dementia, but some people are turning to it for other conditions, including ADHD. We don't know how it might work. We think it may work by increasing cerebral blood flow. The only trial I can find published with it is fairly interesting, at least. It was in 50 kids. They gave 80 to 120 milligrams a day versus methylphenidate 20 to 30 milligrams per day for 6 weeks. These were newly diagnosed kids. 8% in the Ginkgo group after 6 weeks had a 40% improvement in teacher and parent rating scales, compared with 64% in the stimulant group. It doesn't work in a lot of kids. It might be an option to try in kids and see if they respond. And 6 weeks may not have been long enough. It may not have been a high enough dose. The dose in this study was based on weight. Kids who weighed less than 30 kilograms got the lower dose of each medication. So it's interesting information, but it is only one small study. They did see, of course, typical stimulant adverse effects and really only had minor adverse effects with the ginkgo, some GI disturbances. The most quoted study on many ADHD treatment websites with ginkgo is the one on this next slide. This particular study used a combination of ginkgo and American ginseng. It was only in 36 kids. And this study is used on many of these different websites and blogs to support why people should take ginkgo for ADHD. And it was a horrible study. They did this for 4 weeks. It was unblinded, so there were no placebo controls, so they just gave them this product twice a day for 4 weeks. They did see a modest improvement in behavior scores, but placebo might have improved their scores just as much. The important thing was 23 of the 36 were taking prescription stimulants concomitantly, so who knows what the actual effect of the combination of American ginseng and ginkgo is, and whether it's any better than just ginkgo alone. What if a family wants to use ginkgo supplements? Based on just those 2 studies that are out there, I would suggest trying ginkgo alone. Don't throw in the American ginseng. The ginkgo supplements haven't been studied long-term, only up to 6 weeks. There are a lot of long-term studies in adults up to 6 years that have not seen treatment emergent adverse effects occur. So nothing bad seems to happen when you do take ginkgo supplements out to 6 years. There are some adverse effects here that, might occur. Doesn't seem to be a major problem. Drug interactions, though, importantly, when you talk about ADHD treatment, ginkgo supplements have a variable effect on antidepressants. They can induce some and inhibit others. So that's just something to be aware of because many kids may be on an antidepressant or atomoxetine. Also, ginkgo has an antiplatelet effect, usually not an issue in kids. It may be more of an issue when adults are using ginkgo. So it shouldn't be used in combination with other antiplatelet agents or anticoagulation. What about dosing if someone chooses to use ginkgo? Well, the Better study used 80 milligrams a day for those less than 30 kilograms and 120 for those over 30. The supplements that are out there have a wide range of dose in them, from 30 to 240 milligrams typically of the extract per dose. A couple I listed here and a couple of the pictures are of consumerlab.com approved products. The majority of products pass consumer lab testing in recent testing results. In older tests of ginkgo supplements, lead contamination was an issue. That seems to have been resolved. They did not detect any lead in any of the ones they tested currently. I would suggest that parents aim for those particular doses if they want to try ginkgo and give it for at least 6 weeks. What do the published ADHD treatment guidelines say about complementary and alternative therapies? Well, the American Academy of Pediatrics guidelines basically say that there's insufficient evidence on any of these. They don't recommend any of these. They do caution against using chelation and megavitamin doses because there are documented adverse effects with those. They're really not going to necessarily come out and support any of these things. I do know a lot of pediatricians who support the use of omega-3 fatty acids. When families wish to pursue complementary and alternative treatments, what can we suggest to them? I do suggest that they try one intervention at a time. Don't try 6 different things because then you don't know what worked. Now, I also recommend trying products that contain the fewest ingredients because, again, if you have an adverse effect, you don't know what it came from, and if you have efficacy, you don't know which particular part of some combination supplement led to the efficacy. There's some products out there that are heavily touted for ADHD that have up to 72 different ingredients in them. But if somebody's going to pursue complementary therapies, they need to choose a target goal. What are they aiming to do with it? What behaviors are they looking to change? Are they looking to change attention, hyperactivity? What is it? Then they need to monitor those symptoms and document that you got some efficacy. People should be doing this with their prescription therapy too. Then they need to choose a time frame. How long are they going to do this? 4 to 6 weeks. With the bound phosphatidylserine omega-3 product, in their studies, they found it took up to 3 months to actually see optimal efficacy. That's the only product I know of that is looked at when does efficacy begin. For most things, I would tell people try them at least for 4 to 6 weeks, maybe up to 3 months to see what kind of efficacy you're going to get. Since we've reviewed these various products, now let's apply some of that information to a case study. Jennifer's a 10-year-old. She was recently diagnosed with ADHD. She's had attention issues since kindergarten. She fails to finish school assignments and other tasks, has great difficulty sustaining attention to tasks. Her family's joined a support group. They're taking some family behavior training. The pediatrician wants to put her on a stimulant. And the mom says, well, ADHD's only existed for the last few years. There's always been children with these problems and they didn't have to take medication. Well, that's a contradictory statement, first of all. There's always been children with these problems. Yes, we didn't diagnose it many times because there were not effective medications. We know that these medications are effective, but we also have to understand that families many times don't want to expose their kids to stimulants and the possible adverse effects with those. So Mom asked you for your recommendation on fish oils and ginkgo. So what are the options for Jennifer? A big thing I think is kids need to be looked at to see if they have nutritional deficiencies. And nutritional deficiencies can occur over time in kids that are on stimulants that lose their appetite. Right? So they're not taking in enough food. And also you find a lot of picky eaters. Those things need to be looked for, and if they have a nutritional deficiency, let's fix that and see if that changes behavior. Fish oils, I think, are definitely an option if people are looking to avoid prescription medications. Combine fish oils and behavior interventions and see if it works. But again, give it some time. Ginkgo is another alternative, but I think there's less information on using it. I would put that after fish oils. I just wanted to mention a few other treatment options because families may have a lot of questions about the various diets that are touted out there. At least 8 controlled studies have found that elimination diets only benefit a small subset of children with ADHD, and those are children who have documented food allergies, or food sensitivities. So avoiding sugar, aspartame, other artificial sweeteners, and dietary salicylates have not been shown to be widely effective in studies. Avoiding artificial food coloring or preservatives may be beneficial in children with those documented food allergies or sensitivities. These severely restricted diets are difficult to stick with and enforcing kids. For kids who are picky eaters and maybe taking stimulants that reduce appetite, maintaining good nutrition can be difficult. They may need a good multivitamin supplement that doesn't exceed the RDAs for everything to maintain sufficient nutrition. I give you a reference here for a good review of diet-related issues from the American Academy of Pediatrics as a resource. But a lot of parents believe that changing kids' diets makes a difference, and as long as they're not compromising their nutrition, then it works for them. The next slide just lists a few resources. The first one's a good handout that goes over all the non-medication ways to treat ADHD based on scientific evidence. 2 groups that have a lot of good resources are CHAD and the National Resource Center for ADHD. They provide good reviews on all these different complementary and alternative treatments. And it's a good place to refer patients to get scientifically based information. Overall, what's the bottom line? Can supplements be used to manage ADHD? I think there are a few that might be beneficial. I think we do need to ask families about their supplement use to see what people are using in addition to prescription medications. Overall, they're all less effective than prescription medications, and parents need to know that they may be a better choice for someone with moderate symptoms, mild or moderate symptoms versus severe symptoms. Kids with demonstrated deficiencies of any nutrients need to have those corrected because those can impact behavior and they can impact the efficacy of prescription medications. They don't work as well if you got a nutritional deficiency. Think about nutritional deficiencies if prescription medications are not working. Some of these supplements may work as a complement. They don't seem to be a total substitute for prescription medications. The products that show the most promise are omega-3 fatty acid supplements and ginkgo. I hope that this program's provided you some information you can use in your daily practice and help families make some good decisions about their ADHD treatments.